Good morning, everybody, and welcome to today's episode of the Hope Upper Cervical Corner. This is Dr. Kramer coming to you from a different angle of the film, of the series, of the video. Today, I wanted to take a moment to talk to you about normal and abnormal. You see, multiple times throughout the day, we have these conversations with patients where we discuss skeletal structure in relation to neurological performance. And oftentimes people will ask us the question of, well, is that good? Is that bad? What am I looking at? What's positive? What's negative? And so in this discussion that we're going to have today, my big goal and my big takeaway for you is to lead you on a path of basic understanding. I don't need you to know how to read an entire X-ray series. I don't need you to know what we're looking for and what's happening. I just want you to be able to visually take a moment to look at a photo, appreciate it for what it is, and then work through understanding what we're talking about when we see normal versus abnormal. And so this is a website, it's called radiopedia.org, and in it, I just typed in lateral cervical neutral, it's an LCN film, and I typed in normal, right? And this is what they have given us for showing us what a normal X-ray should look like. And if you look at my mouse right here, what I want you to appreciate is that our C1, which is where my mouse is following right now, has a really good spacing between the base of the skull and the second cervical vertebrae. You can see it has a pretty solid angulation going on there on this. The second piece is that if we follow C2 and we work our way down, we have this nice, beautiful curve that is happening right here. And oftentimes what you'll hear is most doctors will talk to you about the presence or absence or lack thereof of a cervical curvature. And in that is a sign of neurological compensation, right? If we do not have an optimal curvature, in which I'm showing you on the mouse right here, we can use my hand, I'll come in here and show you, but we're gonna follow this direction. What I am looking for is somewhere between 20 and 35 degrees. There's a big variance in that, but people are variance in height, weight, distribution, etc. It's when we start getting underneath that 20-degree angle and we start going down towards the negative angulation, which would be curving in the opposite direction, that we start to have some significant neurological problems for patients, right? This is when we start talking to a case about, hey, listen, things are going to take us a little bit of time, right? You have a problematic area happening right here. It's causing compensation in the foundational structures, and it's resulting in you having the presentation that you have. And 9 times out of 10, if we start getting some chunky bone in here, we start having degeneration, our disc height is decreased, and we start seeing the overall structure look pretty compromised, you can expect a rather lengthy time of care to help you reconstitute this cervical curve to reestablish normal neurological function and get you back to function, right? So now the question becomes, well, doc, how often do we check this out? Well, in my case, I like to shoot films pretty much once every, I would tell you, we shoot them probably every 6 weeks, every 9 weeks, somewhere in that range. But what I want to do is I want to show you an example of a patient who is working through care. And what you'll see here is on the right side is an initial film series, and on the left side is a progress film series. And what you'll see is there's about a 6.4 degree improvement and cervical curvature when comparing normal to normal, right? And if we come back over to our film that we have, we can see that there's still much more room for progress to be desired, right? The ideal that we're looking at over on that other film is somewhere probably around like 25 to 27 for this individual. And so what we're seeing here is that the right type of care or the right type of presentation of delivering care should require a doctor to progressively take photos or x-rays of your case to show you that they are reconstituting and delivering that which you asked for. And if you can look at this film, you'll see, this is more than just junky cervical spine. We have some misalignment issues going on in here. We have some structure that's not optimal. And as this is coming over into this new film, you'll see that the alignment is actually moving into a better place. You'll see that this curve is actually reconstituting itself. It's changing. And what's happening for this specific patient is that the neurological issues are decreasing, right? So all of this is evidence that we should collect as a upper cervical doctor in a patient's journey to show them and show you that you are actually truly making progress, and this is not some manufactured nonsense, right? And so some things that people like to do to constitute a curve is that if we look at this spot right here, it's called your hard palate. It's got to be level to the floor, right? I can't take his chin and tuck it down and flatten the neck and then put his nose to the sky to make it look like this beautiful curve. These things have to be same, right? I have to be same setup between films, and I can't lie to you when I do that, right? This is where I have to show you validly that, hey, we got a problem. You know, take our horizontal, hard palate, everything's normal. We come down here, we look at our C2 comparatively, we're normal. This one's a little more straight, a little more upright. This one is starting to get some curvature coming into the back of the neck. We take the bottom of C7, compared it to the bottom of C7, and overall, we got a pretty darn good structure reconstituting itself. So today's upper cervical corner lesson is, what is normal? This is normal. Where am I? Well, if I start here, I probably got a good 6-month journey to move to here. Now, we look at month 3 or month 4, yeah, we're getting there, right? We got improvement. We're making about a 50% improvement in the case. We got about another 25% we're going to improve it by. And then next thing you know, the person is going to be well. That's the goal, right? The goal in here is to use evidence to show that we can make a change that will deliver an optimal environment for the patient. Thanks for tuning in today. I hope this is educational for you. If you got questions about a normal lateral cervical, radiopedia.org, go check it out. You can read to your heart's content. Otherwise, leave a comment. Let us know what you learned. Let us know what more questions you got. Peace.